What is Sonrotoclax?
Sonrotoclax is a class of drugs called a BCL-2 inhibitor, and BCL-2 is a protein that's involved in apoptosis, which we called programmed cell death. So if cells upregulate BCL-2, they essentially have the ability to survive. So the classic drug that was developed for BCL-2 targeting is a drug called venetoclax. It has a long and storied history. It's been studied in trials in myeloma. What's unique about venetoclax is it only works in a subset, and that subset is 11-14. Pretty much everywhere else it doesn't work, and there were actually some risks in other subgroups. So I think we're starting to understand a little bit about personalized medicine here. Right? We got a targeted therapy that works in one particular subtype of myeloma. And if we expand it to every person with myeloma, maybe that's not such a good idea. We got to target it to that one population. So what's Sonrotoclax? It's kind of the guerrilla version of venetoclax. It is a lot stronger. It is an oral drug, so there's that advantage. So really, it's being studied in this 11-14 population. And I think my personal experience with venetoclax is I've had to pull it out in some patients who are in dire situations. And boy, if they had the 11-14, I saw dramatic responses. We had someone on their deathbed that we basically pulled back to life by just giving them venetoclax, right? So, and that wouldn't have happened if they didn't have the 11-14. So that's the population that drug is targeting. It's stronger, so we hope the responses are deeper. And venetoclax resistance is there, and perhaps we don't know enough about this yet, but maybe sonrotoclax can overcome when venetoclax does not work, right? So that drug is being looked at in that space, along with other diseases like chronic lymphocytic leukemia and other lymphomas like mantle cell lymphoma.
Is it studied as a monotherapy or in combination with other drugs?
In monotherapy, typically with some dexamethasone. And I think the other combinations that have been attractive for synergy have been proteasome inhibitors in general.
What are the main side effects of Sonrotoclax?
Low blood counts is the main one I'm aware of. And we can see that with venetoclax also. We have a lot of experience using that agent in a lot of different cancers. There is some GI toxicity, but I don't have a ton of experience with that drug and the side effect profile. But typically, what I've heard is that it's very benign compared to, other agents.